Hey, welcome back to Recovery Rocks. It's Jim from SoberNow.com. Going to talk to you today about the connection between mental health and addiction. Every once in a while, I'd say probably every 5 to 10 years, the field of mental health and the field of addiction kind of reinvent the wheel when it comes to dual diagnosis treatment. That's the term that a counselor would use when folks have both an addiction and a mental health condition. Now, there's millions of people that live with mental health conditions that never abuse substances, never even come close to developing an addiction. But my position, and I think it's slowly becoming the norm, is there's no such thing as a person who has an addiction who doesn't have a mental health condition. For most of us, we started using drugs and alcohol as a way to cope with mental illness, with past trauma. And of course, that coping mechanism over time turns against us. And if we didn't have a mental health condition by the time we developed an addiction, we're certainly going to have one coming out of addiction and from all of the places that addiction brings us. So personally, I'm a big believer in putting sobriety first. Frankly, doing mental health work is unlikely to have a lot of progress until a person's sober. And there's a lot of reasons for that, not the least of which is our lives continue to fall apart the longer we go into addiction, the further we go into addiction. Memory tends to be very poor. Our ability to process information and learn new skills is impaired as long as we continue to use substances to cope or as long as we maintain an addiction. So I say put your sobriety first, leave mental health for afterwards. There's a couple of important pieces to that. The first one is until a person has been clean and sober 6 months, it's almost impossible to get a really accurate sense or an accurate diagnosis of what their mental health condition is. Addiction looks like a lot of different mental health conditions. Addiction, early recovery, detox looks like a person who has really severe mental illness. But that's often not the case. It's just that that's where addiction takes us as it takes over our lives. We behave in a way that looks more and more like severe mental illness. So we need to have long-term recovery and sobriety before we can get an accurate gauge. The exception to the rule that I put into dual diagnosis treatment or dealing with addiction and mental health is that people need to do two things. They need to find strategies and things that help them to feel safe, and they need to find ways to cope that don't involve using substances. So when we're perpetually overwhelmed, and especially for those of us who have survived trauma, when we start experiencing memory, start experiencing intrusive thoughts or overwhelming emotion, we're at far greater risk for using substances. And so learning some basic grounding skills, some safety strategies is going to promote our sobriety that much more. So that exception to the rule, I think, is important. I'm always emphasizing the need for support and the need for accountability. It's great to develop goals. It's great to have some kind of vision about where you want your life to be. But without the combination of support and somebody holding your feet to the fire, progress just is more of a nice idea than it is a reality that we attain. So, a few thoughts on mental health and sobriety. Don't put the wagon before the horse. Don't put the cart before the horse, I guess is the expression. Put your physical health first. Emotional health is going to be an ongoing process. We need to have stability in our lives. We need to have safety and security. Our basic life needs need to be met. So we're going to start at the bottom of Maslow's hierarchy and work our way up. Please email me questions that you have or topics that you'd like to see covered, jim@sobernow.com. And please check out the program that we're offering, both for folks seeking addiction recovery and for their loved ones, 2 separate programs at sobernow.com. Thanks. Have a great day.